related issues. This topic has become very important today because of this competitive world, and everyone wants to have all strengths and potentials in their children to be realized. Madam, please come on the rise. So whenever some difficulty is there, some problem is there, it should be identified as early as possible because help is available almost everywhere. So first talk will be by Dr. Nandini. She is from Delhi only earlier. She was from Delhi, but she is settled in Bangalore now. But she is very, very regular in conferences in Delhi, and most of us know her very well, Dr. Nandini Mudkar, and she will be talking on how to approach a child with delayed language. Yes, ma'am.
Good afternoon, everyone, and thank you to the organizers to give me this opportunity to express this talk. And is it all right? Am I audible at the back? I want to tell you something that from the time I think as pediatricians, we need to understand developmental problems are all chronic morbidity conditions of our own practice. ADHD, a dopamine-related disorder. If you have a preterm follow-up, it's something to do with the brain. Autism, getting on to genetics. So I think as pediatricians, we have great responsibility to diagnose these cases early. Secondly, the neuroplastic brain. We have to take advantage of the neuroplasticity of the brain, which will respond to your intervention. It will respond to what we do if we do it early. And no child will go to a clinical psychologist or to a psychiatrist or to a special educationist below 3 years of age. And if you're going to make a difference in the life of the child, it is going to be below 3 years of age. So this is a very fundamental thing in developmental pediatrics I learned and found it extremely fascinating. So today we'll talk about language delay, how to approach a child. Is this the one? Okay. Let me see I thought this could be a learning objective for us to understand what are language disorders, what are the red flags, what are the differential diagnoses, what screening tools can we use in the office practice, and when should we refer to the authorities. Having problems with this. This is?
This one.
Okay, fine. Now let's talk about this Aditya, who is a 2-year-old child who says 2 to 3 words. He was a full-term baby with no complications at birth. He sees his doctor very regularly, enjoys a very good health. Both his parents are educated and working, and the child is looked after by his grandparents, as both parents work. He can run, play by himself, and parents feel otherwise he's very normal. And as usual, I don't know, in Bangalore it's a craze to put the child by 2 years to school. So the parents came and asked, is my child ready to go to school, and does he have? What do you think? Does he have a language delay at all? The audience? No language delay. Do you think he should be sent to a school by 2 years? No. Okay. Then we'll see. So let's see whether Aditya does have a language delay at all. If so, what could be the cause, and what would you recommend to the parents to do? So these are few facts you should know about language. In the absence of hearing impairment, language is the best predictor of the intelligence in young children. Okay? It accounts for nearly 7 to 10% of childhood disabilities. A busy doctor in a clinic will see at least 1 case of language delay in a day. And it is the most poorly monitored milestones, both by the doctors and by parents. Parents, because they are constantly told that they spoke very late. The grandparents tell them, till 4 years you didn't say a word, now you're a brilliant engineer. Your mother didn't say anything till she was 5 years, she's a brilliant doctor. So that they're constantly misguided. And it is easily missed because when the children come to you to your clinic at 2 or 3 years, they are so scared and shy that they don't vocalize. So you don't get to see them. So, yeah. Oh God. Okay, so this. Having said this, let's understand a little bit about language development. The language has got something called receptive language. That is what you understand. It is ability to understand what? Not just the verbal command, but the non-verbal command. What are they? Gestures. No, I don't want. Please come. No, no, no. Give me small. These are also part of a language. And we also do, of course, listening, reading, and visual signs, which you see, children will recognize. These are all maybe your McDonald's symbol which is there, or KFC symbol, which are very good even at 2 years. This is all a part of receptive language. Express is what you communicate, both through your verbal and gestures. Speech acoustics is your volume, your speech, your prosody, how do you speak in a monotonous tone. When you see an autistic child say, I am going to class every day, but you start, I am going to class every day is another. So this is a tone of a voice also gives you a lot of information. And then the components of the languages are all made of sounds. Whichever, Hindi, Tamil, English, it's all made of sounds. And it's the sensitivity of the ear of hearing these sounds again and again in a particular pattern, strung in a particular way, that becomes a word, and that becomes a sentence, and that becomes the grammar. So we must know what is syntax, which is the grammar. The semantics means there's a meaning. If I just keep simply saying, going, market, it doesn't make sense. If I am going to the market, it makes sense to you. So the way we string our words, the meaning, and of course the pragmatics is the social languages. How do you use certain things? What are the words you use? How do you use it? How do you say it? Is the social part. Okay, sorry. What am I going back? Am I going back? Yeah, sorry. Yeah.
This one.
Sorry, this one. Okay, your computer is a little different. No, okay. Okay. Having said this, now let's see what are the sequence of language development. The first 10 months is the pre-speech, where it is characterized by the child, which localizes sounds and associates it with baba, gugu, mama, bow, dog, doggy, you can see. Cooing and babbling. While cooing and babbling, please understand, child should incorporate not just I, E vowel sounds, but all consonants like pa, ba, ma, brr, pa, ba. All these newer consonants, if it's getting into the language, it's fine. But if it's just doing I, E, even a hearing impaired child can do that, okay? And social routines, the child starts to play. He starts to play peekaboo game with you, a hide, comes to the mother, stand to it. Then early gestures like pick me up. 9-month-old child will show you that. It's very important. From 10 to 18 months is called period of naming. They will name everything. And besides naming, the two important things I definitely want you all to know, what is called a proto-imperative pointing. That is, if a child as young, by 1 year, should be able to, what it wants, show you with a finger. That this is what I want. Anything. And what is proto-declarative is something which is very enchanting. It is, the child will look at you, look at that object and look back with you. Saying, without speaking, he said that that's what I want. So this is called a joint attention. That he takes you into his company for joining attention with you. This, if doesn't develop, language will not develop. So look for joint attention. And child with autism, you will say joint attention is something which is, you will be lacking even at 3 to 4 years of age. 2-step command by 3 years. What is 2-step command? Get me the book and close the door. Not two different things they do. 3-step means you do 3 different things. Get me the book, close the door, and give me a glass of water. 3 different commands. That's called 2-step, 3-step, 4 steps. And then they will start, and verbally they'll start having, this will only do 2-step command by 3 years, 3-step by 4 years, I put it here. But label jargons, like ga, go, go, goo, goo. They may not say, give me dudu, goo, goo, baba, all kinds of jargon. And of course, 1 step by 12 months without gesture, and 16 months they will have a gesture along. Give me along with this. Then 18 to 24 months is called the period of combination. They will have 10 to 15 words. Now do you think your child with the Aditya was normal or not? Is for you to think about. 10 to 15 to 50 words by 2 years. And they will start using a verb and object together. Give milk, dada office, mama go. So this is what they have to say. 3-word sentences by 3 years. I don't want to go, I don't go, I want milk, you know. And by 4 years, they speak 4 words, and by 5 years, they should speak in fluent sentences using past tense, present tense. This is the normal language development. However, you know, everything is a science curve. We have a 3rd percentile and a 97th percentile. That is the 50th percentile, what we talked about. If your child does not respond to sound at all by 6 months, you have to refer. If there is no cooing, babbling or smiling by 6 months, you have to refer. If there is no gesturing by 12 months, you have to refer. If there is no pointing, no words other than mama and papa, or understanding simple commands like though, you have to refer by 18 months. You see how quickly the language is developing. Loss of words or no functional play. What is functional play? They will take a toy cup and drink it like a milk. They will take a doll and put it to sleep. They will take a chammach and make as if, you know, they're making a gruel. Functional play gives intellectual ability. So it's highly related to language. That was my first sentence. If the child does not do a functional play by 24 months, you should be really wary of this child. No 3-word sentences by 3 years, and very, very frequent echolalia. That is, they keep repeating what you say. Most parents come and tell you, "हाँ बात तो अच्छा करता है क्या?" If he repeat what he says, "तुम्हारा नाम क्या है? तुम्हारा नाम क्या है?" This, according to them, the child is speaking, but it is up to you as physicians to find out, is this child really speaking or is it just repeating what it is hearing? Very, very common with autistic children. And if 75% of his speech is not intelligible by this period of 3 years, you have to call it a shot and say something is going wrong with language development. And now, there are variations. There may be just a delay in language development, least problem to worry. If the child is speaking a little bit, if it is not within the red flags area. But what is problem is when there's a disassociation between the other streams of development and language. That is intelligence, social, other things are happening well and child is not speaking. You have to be worried. Or within the language, receptive language comes first and then the expressive language. You'll see in many autistic children, they'll keep babbling something or they're having echolalic speech, but they don't understand. This is a far more serious concern than just a delay. Okay? So delay, deviation and dissociation. You have to be, and you can make this out very easily in your clinic if you just spend. So when does a delay become a disorder? When it is very severe and persisting at school age level, interfering with the social and adaptive skills and academic learning. Dissociation is always abnormal. Expressive delay can be due to an environmental factor where language stimulation does not happen. So a child who understands everything and does not speak so much, I would be less worried, you know. Address, and then of course dysarthria, dyspraxia, cleft labial, everything is due to a problem in the mechanism of speech, and that is entirely a different cup of tea to the speech therapist. So when do you have to worry? When the combined receptive and expressive language indicates of a serious problem. If it has both, then it can be a global delay. The child can be a child with mental retardation. It can be a child with autism. It can be with any of those conditions. Rule out hearing loss. Always. We have no business not to do a BERA or a OAE, whatever you feel comfortable. Must be done by 4 months, but please don't delay it after 6 months at least. Universal hearing test is good with a good history and assessment. You should be able to pick up hearing impairment without any problems. That's not, if it is not hearing impairment, all the other things becomes. And autism spectrum is the worst of all this, a condition which is rising exponentially. Each one of you are seeing cases and you don't know, you are at sea what to do with them, but a good management, early years, below 2 years, starting intervention gives excellent results. So be very, very sensitive to these. So what do you do for evaluation? Listen to parents, don't put it off. Monitor child languages, screen at 9 months, 18 months, 24 and 36 months, just asking few questions for language development. Autism spectrum disorder must be diagnosed by 18 months. What are the screening tools? These are some which are very, ages and stages questionnaire is excellent. Till 5 years or 6 years also, you can buy it on the net. It's not very expensive. Denver is with all of you. Language, the CAT and CLAMS, that is clinical linguistic test, assessment test is very, very good, can be very easily gives you, and this gives the aptitude also. And then my favorite is the Rossetti language, which is cost $20 or $25, but it gives you everything. It talks about gestures, pragmatic, social language, receptive, expressive. You get a total and very, very easy to administer. None of these are any, what should I say, anything big to do. It's very easy. ELMS is something which is there in even in our I think books, whichever you're reading. Development reels is, some people are very fond of using it, but my experience is not much with this. So what are your sequence of workup? You'll take a history, you will do an audiological examination, evaluation, you will look for like red flags, you please monitor and see whether the child has, many times if the child is not speaking in the non-verbal speech, please monitor gestures, understanding, eye movement, body movement. You can make a lot of non-verbal communication, especially in young children. And of course, if every child, you must give a MChat. A language delay child, please do an MChat follow-up for autistic children. This is again free in the net, available in different languages, including Hindi, Kannada, etc. And it's the 23 questions, which will take you 5 minutes to administer, and you will come to know whether your child has got a risk of autism or not. Remember, all these language are all spectrum disorders. So severity can vary. You can say from mild to severe. The mild ones are the ones you will miss, and they are the ones who will be very useful in when you rehabilitate them. If you do any more testing, especially genetic testing, many people do, and it gives very 5% as a results for that. So it's nothing much you can get out of it. Now, what do you do when you have a child with language development? You as a what do you have to tell the parents? That you have to speak and speak and speak to the child. Speak what? Speak in the realm of the child's language. What do I mean by that? What the child sees in his surroundings. Don't give bhashan. Abhi tum wahan jaoge, tumhe chot lagegi, ye hoga, la la la, all that he doesn't understand. He'll say, sit, no touch, chew, fire, you got to speak in sentences which are small, crisp, and to the understanding of the child's environment. Does he see a dog, cat, all these things he'll understand. Seek help early and don't wait and watch. Wait and watch is not, because critical period for language development is best between 18 months to 3 years. If you can do this, you can do a wonderful job of language rehabilitation, especially for hearing loss. 100%, brilliant people, PhDs. ASD best started below 24 months. I want to tell you the sensitivity of pediatricians. When I started practice, my age of referral was 5 years in Bangalore. Today, my age of referral by my general pediatrician is 9 months to 24 months. 9 months, they'll say, doctor, there is something, not making eye contact, no cooing, no smiling. Pata nahi, bachcha ajeeb sa lag raha hai kuch. They'll come tell you, something is wrong, would you have a look at it, And by 24 months, 18 months is average. And if you come to my clinic, I have hundreds of autism spectrum disorder kids, all doing very effectively in the management. It's only my colleagues, my pediatricians who have sent it to me below 24 hours, and they're very interested. They'll say, and I always send it back to them. So Kasi will say, yeah, that child just came and said, played with me in my clinic, he did this, she did this, or they will talk to you on that. So it's very, very, what should I say, to you also, it's a very good feeling when you refer by 24 hours to autism. And imagine what happens to the parents. And above all, imagine what you're doing to the child, because language is a lifetime disorder. You make or break a career of a child, a life of a child. It's not an acute morbidity that I get admitted for 10 days in the hospital and walk out of it. It's going to live with it. And something which you live with, I think you should really, really be very concerned, be acutely aware. Caregiver and family involvement is a must. No program in developmental work will be successful if you think you can do it. If your parents are not partners, when I say parents, it's caregivers, grandparents, whoever it is. I always say, who's looking after the child? Send me that person. And everything when you learn for a child, you need an emotional attachment. If you don't have an emotional attachment, you don't learn. Whether it is subject, whether it's your attitude, your behavior, anything. You're good to your parents because you're attached to them. You like your friends because you're attached to them. Attachment and social skills are key to success in life. And next is communication. And both of them are what is involved in language learning. So you have to have parent as partners, and you must follow up prognosis and programs and see if your program is not working, why is it not working? What have you missed? What is happening to the child? So this is very, very important when you do early language development, that you have partners of parents. They should be given taught the lesson. They should know how to play with the child. Another thing, do you know our parents, what she talked about in teenage, are very authoritarian. How do you all see your parents? Yahan baitho, wahan nahi jana beta, gir jaoge, you don't do this. We are always giving them instructions. We are like directors of a film, that instructive parents have very poor language development. They can't do much. What is it you need? You have to tell them, how do you play with your child? How do you partner with your child? You put one block, I will put, You do this, I will imitate you. The children love to be imitated. Tell your parents to imitate your child. He makes two noises, you make one, and you make a third new sound, he'll try to imitate you. Because he says, this is very exciting, there's somebody like me. And if you just throw your weight around as parents and say, do this, don't that, और कुछ नहीं करता सर, मैंने बहुत कोशिश कर ली, सब कुछ कर लिया मैंने, वो नहीं सीखता, This is the attitude they come to us with. And when we do a video clipping, and I do this, we have a one-way mirror, we say just play with you. My first session is play with the child. Parents will just sit there, अच्छा, they are telling him, ring, इसको ठीक तरह से डालो, इसको तुमने गलत डाल दिया है, ring, I mean, even any toy you give them, they're just wanting to do perfectly. That's not the way a language develops. You give an opportunity to do for the child to participate. And second, please give 10, 15 or 20 seconds for the child to respond to you. Because immediately, acha nahi hua, chalo isko dalo, no, it doesn't. 20 minutes, 20 seconds it takes for the brain to process information. So wait, observe, wait, and then do the thing. Listen to them. It's called the OWL approach. Is the best way to develop language. Outcome, 40% of early language delay in children will be poor reader and cognitive development in school. So your school performance, learning disability, etc., can be predicted as early as your 2 and 3 years. Preschoolers with language disorders have very high risk of language-based learning problem. They are the ones who will be LDs. Parents often talk about them speaking late, but this problem should be swallowed with a pinch of salt. I already told you, don't go by what they did. You be very concerned with the present. One lovely child came and told me, yesterday went by. The future looks like a magic. Today is what is, it's a gift. That is why it's called a present. This one, 5-year-old child came and told me, it's today is the gift, because that's why it's called present. So this is what you have to do. You have to be in the presence. Language content should not be dismissed with casual reassurance. Arey sab kuch theek ho jayega, tum fikr mat karo. We do this very often. I'm so sorry as pediatrician. We said, kya jaldi hai, baad mein baat karna, Don't do that. Take home messages. It is common. It's a hidden disorder. You have to look for it. Deviation, dissociations are more serious. ASD is rising and alarmingly, and parent and education are partners. Thank you very much. You and I are together in this, so we can't do anything without each other. Please partner in endeavors. Thank you.
Thank you, madam, for a very elucidative talk on language delay. And I hope we can pick up it very early and refer to an appropriate person like you here in Delhi, so that we can pick up it early and do appropriate management. Next talk is on when is it a learning disability by Dr. Rajiv Sharma, who is a consultant psychiatrist at Mata Chanan Devi Hospital and Max Hospital, Gurgaon. He has a specialization in child psychiatry and a very frequent orator at FM radio, TV shows and CMEs. Dr. Rajiv Sharma, please.
Hi. Good afternoon, friends. मैं prefer करता हूँ हिंदी या पंजाबी या थोड़ी बहुत इंग्लिश. मैं डॉक्टर राजीव हूँ. मैं MBBS मैंने इंदिरा गांधी मेडिकल कॉलेज शिमला से किया था, MD एम से, और स्कूलिंग मेरी सेंट मार्क्स C1 जनकपुरी से हुई है. So I belong to this area only. Today I'll be presenting on what is learning disability. फर्स्ट ऑफ ऑल आई वुड लाइक टू शेयर, एक तो मैं लर्निंग डिसेबिलिटी का केस हूँ खुद, और मुझे ये रियलाइजेशन हुई थी व्हेन आई वाज इन 3rd ईयर ऑफ पीजी. बिकॉज साइकेट्री में भी लर्निंग डिसेबिलिटी ज़्यादातर लोग तभी पढ़ते हैं जब एग्ज़ाम नज़दीक आ जाते हैं, बिकॉज आपको एक क्वेश्चन तैयार करना होता है। तो जब मैं वो पढ़ रहा था तो मुझे लगा यार कुछ तो ऐसा है। वो मुझे कैसे रियलाइज़ हुआ, जब मैं 9th स्टैंडर्ड में था तो मैंने इंग्लिश में, मैम ने कहा डायलॉग लिखो, तो मैंने लिखा था DIALOCK। तो टीचर ने मुझे आगे बुलाया और बोला सबके सामने पढ़ो। मैंने पढ़ दिया DIALOCK। एवरीबडी वाज लाफिंग बट आई कुडंट अंडरस्टैंड कि क्या गड़बड़ है इसमें, कि डायलॉग है मतलब DIALOCK। देन आई रिमेंबर्ड माई फादर यूज टू से सलमान खान की जगह सुलेमान खान, एंड मॉरल साइंस की जगह मोरल साइंस। तो मुझे लगा फादर को भी कुछ प्रॉब्लम है इसका मतलब। देन समथिंग वेरी ड्रामेटिक हैपेंड, जब मेरी बेटी अपर KG का एग्जाम दे रही थी और मेरी वाइफ से एक थप्पड़ पड़ा उसको। तो सिंस मैंने बचपन में बहुत मार खाई है पढ़ाई के चक्कर में, बिकॉज माई फादर IQ इज़ 150+ एंड ही इज चीफ इंजीनियर इन मर्चेंट नेवी। तो जिनके भी पेरेंट्स बड़े इंटेलिजेंट होते हैं उनके बच्चों का फ्यूचर बड़ा ख़राब होता है। सो व्हेन शी गॉट ए स्लैप तो मुझे बड़ी इरिटेशन होती है, मतलब आई हैव नॉट बीटन माई चाइल्ड एंड आई कांट सी माई चाइल्ड बीइंग बीटन इवन इफ शी इज़ माई वाइफ। तो मैंने कहा तू पीछे हो जा, मैं पढ़ाता हूँ। तो दैट वाज दिस एंड दैट, मुझे समझ नहीं आया दिस कहाँ लगता है एंड दैट। सो ऑन दैट डे आई रियलाइज्ड कि मेरी डॉटर को भी वही प्रॉब्लम है जो मेरे फादर को भी है, मुझे भी है और मेरी बेटी को भी है। एंड समथिंग वेरी इंटरेस्टिंग, माई वाइफ इज MA BEd in English and she got 82 in boards or 92 in boards, which I don't remember exactly, but she also got 33 in maths. So so एग्जामिनर ने तरस खा के पास किया होगा मोस्ट लाइकली, है ना। सो व्हेन इट कम्स टू कॉन्फ्लिक्ट रिलेटेड टू लैंग्वेज और मैथमेटिकल एबिलिटीज, मेरी डॉटर को अगर मैं समझा दूँ टीवी कैसे चलाना है तो वाइफ को सिखा देती है बजाय टीचिंग हर। सो देर आर सटल डिफरेंसेज बिटवीन मेल्स एंड फीमेल्स एंड दे आर डिफरेंट, दे डोंट हैव टू बी सेम। बट हमें ऐसा लगता है कि बिकॉज usually my daughter, you can say, is slightly exceptional, she is good in maths, poor in Hindi and English. Usually what happens is males are more good in mathematical abilities. That's why it is not a gender bias. 98% of the pilots are males, and this is a fact, and this fact is not going to change over a period of time. Doesn't matter how much development we have. And it is not that female cannot be pilots, because spatial abilities are better for males. Similarly, multitasking is always better for a female. Because I used to realize when I used to drive, even बच्चे गाना सुन रहे हैं या वाइफ चेंज कर रही है चैनल, I find irritated because men are very focused. But at the same time, lady जो है टीवी भी देख रही है, खाना भी बना रही है, बच्चे को भी बोल रही है तुम ऐसा मत करो. So she is gifted in that particular area. So लर्निंग डिसेबिलिटी का इंटरेस्ट मुझे तभी जागा जब मैंने वो एग्जाम देते हुए रियलाइज़ किया कि ये प्रॉब्लम मुझे है. एंड इंसिडेंटली माई थीसिस वाज आल्सो इन चाइल्डहुड एंग्जाइटी डिसऑर्डर्स. सो आई हैड अ गुड एक्सपोजर ऑफ चाइल्ड साइकेट्री बट नॉट ऑफ लर्निंग डिसेबिलिटी इवन बिफोर I completed my MD. After that, I really got passionate. We have done multiple school presentations. Now more than 25 school presentations we have done. This is one of the camouflage. It might not be visible. That different in Dwarka itself, we have done around 10-15 schools, 5-10 schools in Janakpuri and some in Paschim Vihar also. And I am very passionate about this project, and we are doing it very successfully with our clinical psychologist Kalasen Gupta ma'am. She is also sitting here. So अगर कोई केस आता है तो मैं ट्रीट नहीं करता because मुझे खुद ही नहीं आता. She is the one who takes care of learning disabilities. This slide basically जब भी कोई बच्चा नहीं पढ़ता है उसके 3 कारण होते हैं. बच्चा एक्चुअली में इंटेलिजेंट है बट उसके नंबर नहीं आते हैं. That is, he is having learning difficulties. He is not to make a keen effort. कई घर वाले बोलते हैं ना तो बहुत इंटेलिजेंट है बट मेहनत नहीं करता. So that is the second scenario. And third scenario, he might physically or neurological problems. This chart itself summarizes the whole presentation very beautifully. अगर हमें ये समझ आ जाता है तो कुछ भी पढ़ने की ज़रूरत नहीं पड़ती है. नंबर 1, कुछ बच्चे होते हैं उनको चश्मा लग जाए सारी प्रॉब्लम ख़त्म, बिकॉज उनको दिखाई नहीं देता तो बेचारे लिखेंगे कैसे. और डफ एंड डम है तो अगर डेफ हैं तो डम हो गई. सो अगर कोई न्यूरोलॉजिकल प्रॉब्लम है और उसका इमीडिएट सॉल्यूशन हो सकता है तो चाइल्ड विल बी परफेक्ट बिकॉज IQ इज़ नॉट एन इशू. और मे बी somebody is on anti-epileptics, so he is cognitively dulling or some other things are there, so he is not able to study. Then second thing is somebody is having mentally challenged or mentally retarded, but majority IQ will be around 70 to 50, that is mild mental retardation. 69 to 50, but that to 85% of the kids will be able to study up to 6th standard. So it is 1%, and out of that 1% also 85% will be able to read up to 5th to 6th standard. So that is not a very big issue as such. So you can say 1 in 1000 child will have a problem significant enough because of mental retardation. But when it comes to specific learning disability, and hats off to Amir Khan, बिकॉज आमिर खान की मूवी से पहले मैंने मुश्किल से 7-8 केसेस देखे थे लर्निंग डिसेबिलिटी के, और उसकी मूवी के 1 महीने के अंदर ही मैंने 10-15 केसेस देखे थे स्पेसिफिक लर्निंग डिसेबिलिटी के. सो दैट इज समथिंग ही रियली सेंसिटाइज्ड पीपल एट ए लार्ज स्केल. उसमें चाइल्ड इज नॉर्मल, IQ हम करेंगे, यू कैन फाइंड द डिफरेंस. जब मैंने अपनी वाइफ को कहा कि हम IQ टेस्ट कराते हैं, मैम ही करेंगी, फ्री में होगा, तो शी वॉज नॉट रेडी. मतलब लोग फ्री में भी कराने में डरते हैं कि साइकेट्रिस्ट या साइकोलॉजिस्ट के पास जाएंगे तो लोग क्या कहेंगे. So that is the irony, मतलब, but after all her IQ was done, and my daughter IQ was 128 in maths but 83 in Hindi and English. So it is very well understandable. More than 40-point difference between her abilities in mathematics, and I could clinically also see it. जब maths का Olympiad exam होता है तो she used to tell me कि पापा maths की कोई बुक खरीद के ला दो, और उसके पेट में दर्द होता था हिंदी इंग्लिश के एग्जाम से पहले. तो अब नहीं होता है. Now we kept a tutor, and because वाइफ शी इज MA BEd इन इंग्लिश एंड गिफ्टेड इन लैंग्वेज, तो वो समझ नहीं सकती है दर्द हमारा, तो इसके लिए सिमिलरली जैसे हम टेक्निकल स्किल्स में हम नहीं समझ पाते कि समझ क्यों नहीं आ रहा, तो बिकॉज जो चीज़ हमें समझ आती है हमें लगता है सबको पता होनी चाहिए, जो हमें नहीं समझ आती वो क्यों नहीं समझ आती, डफर हैं ये लोग, है ना. सो बट SLD आई कैन से वेरी कंफर्टेबली एटलीस्ट 10 people will be sitting here who will be like me only, because the prevalence is very high. It is around 10%, and out of this 3:1 is the ratio, 3 with the boys and 1 with the girls. So boys are more prone to specific learning disability compared to the boys. Then ADHD is also very close to my heart because I have lot many patients in my clinic because of it, and ADHD is also around 4 to 8% depending on the how stringently you apply the criteria, and this is also constituently 4 to 8% SLD, then 10%, in combination they are 20-25%. Comorbidity is very high between, and it goes like this. बच्चे को पहले ADHD है, फिर उसकी पढ़ाई में प्रॉब्लम आई, फिर स्कूल में वो बदतमीज़ हो गया, एंड 50% ऑफ द रेफरल कम्स जब स्कूल वाले धमकी देते हैं कि अब इसको हम और नहीं रखेंगे, आप देख लीजिए या डॉक्टर से सर्टिफिकेट लेके आइए. Then the last thing is because child is not treated properly, so either he will become defiant, उसको चीज़ें तोड़ना शुरू कर देगा, बच्चों को पीटना शुरू कर देगा, या फिर वो शाई हो जाएगा, डर जाएगा, घबरा जाएगा. रेस्ट ऑफ द प्रेजेंटेशन आई विल टेक स्लाइटली फास्ट. सो रीडिंग है तो विल कॉल इट डिसलेक्सिया विच एवरीबडी नोज. राइटिंग में मतलब बहुत सारी गलतियाँ होती हैं, वो कीड़े मकोड़े मारना जिसको बोलते हैं, दैट इज़ राइटिंग प्रॉब्लम्स. 9th स्टैंडर्ड में मैंने इंग्लिश के आंसर्स 3 बार लिखे थे, मेरी टीचर ने ऐसे पकड़ के 3 बार ऐसे फेंका था, और चौथी बार बोला था राजीव तुम तो सुधरोगे नहीं, मैं राइट चेक करके थक गई हूँ, इसलिए अब दोबारा कॉपी लाने की ज़रूरत नहीं है. दैट इज़ राइटिंग प्रॉब्लम. Then is language, people are not expressive, जैसे मूवीज़ में आई लव यू बोलने में लोगों को शर्म आती है, दैट कैन बी सोशल फोबिया ऑल्सो, बट सम पीपल आर नॉट एबल टू एक्सप्रेस एग्जैक्टली वट दे वॉन्ट. मैथमेटिकल में प्लस की जगह मल्टीप्लाई हो जाता है, माइनस की जगह डिवाइड हो जाता है, और 43 - 8 जो है वो 45 हो जाता है, बिकॉज दे -8 फ्रॉम 3 रादर देन माइनसिंग 43 फ्रॉम 8. मोटर में चम्मच से खा नहीं सकते, बटन नहीं बंद कर सकते, या अगेन कर्टसी टू करण जौहर, कभी खुशी कभी गम में वो शू लेसेस नहीं बांध पाता, एंड इट इज़ लाइफ टाइम. तो ऋतिक रोशन की दाई माँ उसे पहचान लेती है बिकॉज उसको तब भी शू लेसेस बांधने नहीं आते. और अगर आपको ठीक से याद हो तो अमिताभ बच्चन की टाई भी जय वादड़ी बांधती मूवी में. सो इट इज़ अ जेनेटिक लोडिंग ऑल्सो. 50% पीपल विल हैव फैमिली हिस्ट्रीज. देन देयर इज डिफिकल्टी इन ऑर्गेनाइजिंग थिंग्स. वी वोंट गो इनटू डिटेल्स लाइक दिस. पढ़ाई में वही है, उसको साउंड समझ नहीं आएंगे. जैसे ए लेटर है, ए लेटर हमें दिखाई भी देता है, सुनाई भी देता है, हम उसको लिखते भी हैं और फील भी कर सकते हैं अगर लेटर बच्चे के पास खेलने के लिए है. तो चारों ही चीज़ें अलग हैं. सेंसरी इंटीग्रेशन इज़ द वर्ड विच इज़ द राइट वर्ड. साइकोलॉजिस्ट पीपल विल बी बेटर इन telling you what exactly it is, because eye hand coordination है and all those things. Child is able to understand but he is not able to coordinate, तो वो उस तरह से perform नहीं कर पाएगा. Then राइटिंग में there will be multiple mistakes, and mirror images होता है B का D बनाना, which is very common with class teachers. Class teachers are able to find it very very easily. Usually not the doctors, it is the class teacher who diagnose. Why? Because she can compare 40 kids from a single kid. तो अगर 2 ही बच्चे शरारती हैं, क्योंकि घर में तो हमारा बच्चा थोड़ा चंचल है, एवरीथिंग इज नॉर्मल, नोबडी रियलाइजेस, सडनली यू पुट हिम इन स्कूल एंड 2 दिन में टीचर कहती है आपका बच्चा बड़ा बदतमीज़ है. पेरेंट्स फील वेरी ऑफेंडेड कि ये पैसे भी लेते हैं, ध्यान नहीं देते हैं, ऑल दोज थिंग्स, बिकॉज शी इज एबल टू कंपेयर 40 kids फ्रॉम दोज 2. तो डेफिनेटली टू आर हेडिंग ADHD or some behavioral issues. Then again with the writing, again she can very easily make out, because B को D बनाना, E की मात्रा, U की मात्रा and all those things. Then language ma'am has taken very properly. Then mathematical, then motor, then very important area why people are not able to learn is, जब मेरे क्लिनिक में कोई पेशेंट आता है तो मैं कहता हूँ जैसे आपने एक महंगा कैमरा खरीदा, अगर वो कैमरा हिल रहा है तो फोटो अच्छी नहीं आएगी, इसका मतलब बच्चे को ADHD है। और हमने उसको दवाई दी, ADHD ठीक हो गया, फिर भी फोटो अच्छी नहीं आ रही, इसका मतलब उसका लेंस चेक करना पड़ेगा। तो वी हैव टू गो फॉर IQ टेस्ट टू सी वेदर ही इज मेंटली नॉर्मल और ही माइट बी हैविंग स्पेसिफिक लर्निंग डिसेबिलिटी। एंड स्पेसिफिकली मैं क्लियर कर देता हूँ उनको कि हम IQ इसलिए नहीं करा रहे हैं कि हमें किसी भी तरह का शक है कि आपका बच्चा इंटेलिजेंट नहीं है, हम इसलिए IQ करा रहे हैं ये देखने के लिए कि किसी खास सब्जेक्ट में तो इसको प्रॉब्लम नहीं है, बिकॉज अदरवाइज पेरेंट्स फील वेरी ऑफेंडेड एंड दे कांट अंडरस्टैंड वाई, बिकॉज सब पेरेंट्स को लगता है ये तो रिमोट कंट्रोल से टीवी भी चला लेता है, इसको तो कंप्यूटर के बारे में बहुत कुछ पता है, बिकॉज देज आर वेरी इजी गैजेट्स, ये तो मोबाइल में गेम भी खेल लेता है, सो इसको क्या ज़रूरत है। सो यू हैव टू वेरी वेल, अभी लेटेस्ट ही एग्जाम्पल हुआ था, आई वॉज इम्प्रेस्ड बाय द कंट्रास्ट। एक दिन एक पेशेंट आया, ही इज़ ए ऑटो रिक्शा ड्राइवर, वो अपनी वाइफ को जब मैम के लिए सेशन के लिए आती है, उसकी वाइफ ऑटो रिक्शा में छोड़ के जाते हैं सरदार जी, और वो फुल कमिटेड है। और सिमिलरली अगले दिन मेरे पास पेशेंट आया, वो बच्चे को डांस क्लास भी भेजती है, ट्यूशन भी लगाती है, बट वो सेशंस की फीस देने के लिए रेडी नहीं है बिकॉज वो बहुत महंगा है। तो आई वाज सीइंग द RNE ऑफ द लाइफ, इफ समबडी इज कमिटेड, बिकॉज अगर वो पढ़ ही नहीं पाएगा तो वो काम कैसे करेगा। एंड यूजली द राइट एज इज अराउंड फर्स्ट स्टैंडर्ड और upper KG, I would say, technically possible, because I have seen personally leaps and bound change in my daughter's life. मेरी डॉटर ने अभी भी एनुअल डे फंक्शन में पार्टिसिपेट किया हुआ है, पूरे स्कूल लाइफ में मैंने कभी किसी फंक्शन में पार्टिसिपेट नहीं किया, पूरी MBBS टाइम में मैंने किसी फंक्शन में पार्टिसिपेट नहीं किया। एम्स में वो ग्रिल कर देते थे आपको कि 3 प्रेजेंटेशंस होती थी, जर्नल क्लब, क्या कहते हैं, जर्नल क्लब होता था, और एक केस प्रेजेंटेशन होती थी, और एक टॉपिक पे प्रेजेंटेशन होती थी, और मुझे बुखार चढ़ जाते थे उनसे पहले। मुझे आज भी याद है जब मैंने पहली प्रेजेंटेशन दी थी, 4 स्लाइड्स के बाद बोला था आई एम सॉरी, आई विल स्टार्ट फ्रॉम अगेन, आई एम नॉट एबल टू रिमेंबर व्हाट टू से। So that was my state of affairs, and last year I think so out of 365 days I was around 70 days on the stage. So but my daughter is able to do at this age. So this is the amount of difference you can create in a child's life. I am very stubborn, whatever I want to do I will do it at any cost. So that habit saved me. Otherwise confidence बहुत कम हो जाता है, and I'll show you what happens really. तो this is very very important कि जितनी हम जल्दी ट्रीट कर दें, बिकॉज कोमॉर्बिडिटी इज़ वेरी हाई ऑल्सो, एज आई टोल्ड यू कि जो इनको ADHD होगा उनको लर्निंग डिफिकल्टी भी होगी, क्योंकि ज़िंदगी में सबको खुशी चाहिए। लोग शराब भी इसीलिए बोलते हैं, अगर शराब भी छोड़नी है तो उसको छोड़ने के लिए भी एक ऑल्टरनेटिव हैप्पीनेस होनी ज़रूरी है, अगर वो नहीं मिलेगी तो वो दारू भी दोबारा शुरू कर देगा। सिमिलरली बच्चा जो नहीं पढ़ रहा, टीचर बोलती है तुम नालायक हो, घर वाले बोलते हैं तुम नालायक हो, रिश्तेदार बोलते हैं तुम भी नालायक हो, तो बच्चे की तो ज़िंदगी में कुछ खुशी नहीं बची है, बोलते तुम सभी बेकार हो। दैट वट रियली हैपन्स इन। और वो ज़्यादातर बच्चे कंप्यूटर या टीवी से फिडल करते हैं या पैट्स के साथ, बिकॉज टीवी कभी नहीं बोलेगा कि तुम नालायक हो। सो दैट इज़ वेरी वेरी इंपॉर्टेंट। सोशल इंटरेक्शन जो है बहुत कम हो जाती है, और ज़िंदगी में काफ़ी लोग आर्ग्यू करते हैं मेरे से, बट एक्चुअली ये फैक्ट है 10% ऑफ द सक्सेस डिपेंड्स ऑन द टैलेंट एंड 90% ऑफ द सक्सेस डिपेंड ऑन सोशल स्किल्स। सो अगर लैंग्वेज डेवलप नहीं हो रही है, एज द मैम वाज सेइंग, ऑलमोस्ट लाइफ इज रूइंड। दैट्स व्हाई पॉलिटिशियंस आर मोर रिचर देन IAS ऑफिसर्स। देयर इज नो डाउट कि IQ इज मोर ऑफ IAS ऑफिसर, बट दे आर नॉट दैट सक्सेसफुल बिकॉज मोस्ट इंपॉर्टेंट स्किल इज social skill. Even just like Anna Hazare, I also have a great faith in him. So he is not that educated. Why? Because he has a very good social skills. तो अगर बच्चा social skills में लैग कर रहा है, वो मम्मी डैडी से नहीं सीख रहा, टीचर से नहीं सीख रहा, और दूसरे बच्चों के साथ नहीं खेल रहा, इससे ज़्यादा क्रिमिनल एक्ट उसके लिए कुछ नहीं हो सकता। तो वी शुड मेक श्योर ए चाइल्ड इंटरेक्ट्स एंड ही प्लेज आउटडोर्स रादर देन जस्ट ऑन द कंप्यूटर एंड द टीवी। अदरवाइज वो एंशियस हो जाएगा, डिप्रेस्ड हो जाएगा, बाइपोलर या टिक्स हो जाएंगे। These are the problems, and to be very honest, पहले तो ये चीज़ें मैंने MD में नहीं सीखी, अब तो आई एम डीप इनटू इट। कई बार बच्चे 15-16 साल की उम्र में जब बिहेवियर प्रॉब्लम से आते हैं, इसने अपना हाथ काट लिया, गर्लफ्रेंड का नाम लिख लिया, या कोई सेक्सुअल चीज़ होगी या एडिक्शन होगी, व्हेन आई टेक ए हिस्ट्री ही टर्न्स आउट टू बी ADHD एंड वी स्टार्ट ए मेडिसिन ऑन ADHD, ही इम्प्रूव्स। जो मैंने भी ढंग से नहीं पढ़ा था, टू बी वेरी ऑनेस्ट, ड्यूरिंग माई MD टाइम्स आई वॉज नॉट टॉट लाइक दैट, but retrospectively I have treated such cases and they are normal, and they are bringing their relatives from Muzaffarnagar or Ghaziabad, and because it is a genetic. और कई बार होता है पेशेंट आता नहीं है, कई बार क्या होता है रिश्तेदार का बच्चा ठीक हो गया, इसका ठीक हो गया, मैं भी कराऊंगा, तो इट गोज लाइक दैट वे ऑल्सो। So that is also very very significant, because Anybody who is having ADHD will be at higher risk of smoking, unemployment, job stress, divorce, accidents, and all those things. They will use more. What are the problems? He will have low self-esteem, poor social skills, attention problems, organizing difficulties. जैसे पढ़ाई करनी है तो कब पेंसिल लानी है, कब रबड़ लानी है, कब शार्पनर लाना है, आधा घंटा तो इसी में बीत जाता है. देन टाइम मैनेजमेंट जो है वो बहुत पुअर होगी, पेपर पूरा नहीं हो पाएगा या पेपर छोड़ देंगे. देन पुअर एकेडमिक परफॉर्मेंस, ज़्यादातर इसी की वजह से पेरेंट्स आते हैं क्योंकि बच्चों के नंबर आने बहुत ज़रूरी हैं. तो अगर बच्चों के नंबर नहीं आएंगे तो कैसे होगा. स्कूल रिफ्यूजल इज ऑल्सो वन ऑफ द रीजंस व्हाई पीपल कम टू ए पीडियाट्रिशियन और ए साइकाट्रिस्ट और ए साइकोलॉजिस्ट. देन ट्रूएंसी इज रनिंग अवे फ्रॉम द स्कूल. मैं उनको यही समझाने की कोशिश करता हूँ कि शादियों में जब हम उन रिश्तेदारों से बात नहीं करते जो हमें अच्छे नहीं लगते, तो आप बच्चे से कैसे उम्मीद करते हैं कि वो रोज़ स्कूल जाए, रोज़ अपनी बेइज्जती कराए और उसके बाद रोज़ मोटिवेट हो जाए, यू कैन डू इट, यू कैन डू इट. मैं बोलता हूँ आपकी सास आपको बोले रोज़ दाल ऐसे बना, दाल ऐसे बना, आप सुनोगे? बोलते हैं क्या बात कर रहे डॉक्टर. The same is happening with the child. Why we are ruining his life? So rather than understanding the problem, they want कि नहीं हमारे हिसाब से ठीक करो. एक बार तो बड़ा इंटरेस्टिंग केस हुआ था. We did some publicity act in front of school, so we got a referral. वो बंदा आया, क्लासिकल SLD का केस था, बिटिया को इंग्लिश हिंदी में प्रॉब्लम थी. तो I told him कि इसका IQ कराना पड़ेगा and so is the cost. So he was offended. तो I told him अगर आपकी वाइफ का सर दर्द होगा और मैं बोलूँगा MRI तो करा लोगे? कहता हाँ. मैंने कहा वो तो डबल द कॉस्ट है. कहता नहीं लेकिन वो मुझे समझ आ रहा है. मैंने कहा कोई बात नहीं है, इमरजेंसी नहीं है, आप जाइए 6 महीने बाद, साल बाद आइएगा. सो ऐसा भी होता है और ऐसा भी होता है कि पीपल कम एंड दे सेल्फ डायग्नोज फ्रॉम द नेट एंड दे, सो एवरी टाइप ऑफ केसेस आर देयर. पीपल, आई टोल्ड यू ना, अंडर ऑटो रिक्शा आई ऑल्सो फील वेरी ओब्लाइज्ड. मतलब आई फील लाइक कि मैं इसकी फीस कम करूँ बिकॉज ही इज सो कमिटेड विद हिज सन. एंड देयर आर पीपल हु कैन रियली अफोर्ड, बट दे कांट अंडरस्टैंड ना कि ये ज़रूरी है, तो उनको समझ नहीं आता. बट दे डोंट नो व्हाट दे आर कॉस्टिंग. कि एक बच्चे को गाड़ी खरीद के देना, एक बाइक खरीद के देने के खर्चे से बहुत कम है. इट इज़ ए लाइफ स्किल. अगर ये मिस हो गया, इट्स बिकॉज आई वॉज ए माइल्ड केस, आई वॉज नॉट ए वेरी सिवियर केस. अगर मैं सिवियर केस होता तो शायद मैं स्कूलिंग पूरी नहीं कर पाता, बिकॉज मेजॉरिटी ऑफ देम वुड नॉट बी एबल टू कंप्लीट ए स्कूल. 6वीं से 10वीं के बाद बच्चे हाथ खड़े कर देते हैं. अभी सीन एक मुझे लीलावती हॉस्पिटल बड़ा फैसिनेटिंग लगता है बिकॉज सारे फिल्म स्टार्स अभी वहीं एडमिट होते हैं. तो एक पेशेंट हमारे पास भी आई थी लीलावती हॉस्पिटल से. आई वॉज वेरी हैप्पी कि हमारा क्लिनिक का स्टैंडर्ड भी बढ़ गया बिकॉज लीलावती हॉस्पिटल वाला पेशेंट जो है हमारे पास आया एंड इट वॉज फ्रॉम दिल्ली एंड एक्चुअली शी वॉज SLD. 3 साल से उन्होंने CT स्कैन, MRI, बिकॉज दे वर फ्रॉम द रिच फैमिली एंड मैम सॉ द केस. तो वो पढ़ नहीं रही थी साल भर से, तो वो लीलावती हॉस्पिटल तक चले गए पेट दर्द के लिए, CT स्कैन के लिए, वो जो सोमैटिक सिम्टम्स होते हैं, रादर देन अंडरस्टैंडिंग व्हाट इज द कोर प्रॉब्लम. आई वॉज ऑल्सो सरप्राइज. आई विल फिनिश ऑन टाइम. सो इमोशनल प्रॉब्लम्स हो सकती हैं. देन असेसमेंट के लिए इट इज़ डिटेल इंटरव्यू, बट आई हैव प्रैक्टिकल एक्सपीरियंस. टीचर्स आर द वन who first recognize, then comes the pediatrician, and the last comes the psychiatrist or a psychologist, because they are not the first people whom usually they approach. But now the times, because of the website and internet, things have slightly changed over a period of last 2-3 years, which I have seen. Then it is a multidisciplinary approach because child might be suffering from other comorbid medical problems also, comorbid psychiatric problems also. Because for ADHD it is the psychiatrist, because psychiatrist can only prescribe methylphenidate. Apart from them, atomoxetine, which can be prescribed by pediatrician also. When it comes to SLD, it is corely and solely case of a psychologist, not a psychiatrist. Psychiatrists are not well versed with specific learning disability, neither they have the abilities to treat until unless they have done some special course. Then it is something which is throughout life. आज भी अगर आप मेरे से स्पेलिंग लिखवाएंगे तो मैं आज भी गलत करता हूँ. I take professional lectures on part time basis, तो मैं अभी भी गलतियाँ करता हूँ. So that is part of my personality. अगर मुझे सुधरना है तो मुझे भी 6 महीने से 1 साल का सेशन चाहिए, जो अब मैं इंटरेस्टेड नहीं हूँ. So रादर देन ये समझने के कि बच्चा को हम कैसे पढ़ाएं, हमें ये समझना चाहिए कि बच्चा कैसे पढ़ना चाहता है. ठीक है. द लास्ट स्लाइड्स, दीज आर द ग्रेट पीपल. खत्म हो गया सर. ये वो बड़े बड़े लोग हैं जिनको दुनिया ने रिजेक्ट किया और इन्होंने दुनिया को सिखाया. दे वर और आइदर सफरिंग फ्रॉम स्पेसिफिक लर्निंग डिसेबिलिटी, दिस इज थॉमस एडिसन, और दे आर सफरिंग फ्रॉम ADHD. लियोनार्डो दा विंची, ही यूज्ड टू राइट लेफ्ट टू राइट की जगह राइट टू लेफ्ट. Then Winston Churchill, his father used to tell that my son is an idiot. Then ग्राहम बेल, देन ही इज़ ए फेलो जिसकी वजह से बिल क्लिंटन और टोनी ब्लेयर इलेक्शन जीते थे. ही इज़ ए शेफ. ईटिंग की थोड़ी हैबिट्स की इंपॉर्टेंस होती है, शुगर कोटेड और प्रिजर्वेटिव्स नहीं लेने चाहिए. देन वॉल्ट डिज्नी. टॉम क्रूज ने 15 स्कूल बदले थे 12 साल में, अब तो वैसे 15 लड़कियां भी बदलनी होंगी इसमें. देन इज जिम कैरी, जो सबको हंसाते हैं, स्टिल ही सफरिंग फ्रॉम ए बाइपोलर एंड ही इज ऑल्सो SLD ADHD. विलियम स्मिथ. जस्टिन टिम्बरलेक. पेरिस हिल्टन जो इंडिया आई थी थोड़े दिन पहले, शी इज ऑल्सो ऑन मेडिसिन. 50% लोगों को मेडिसिन लाइफ लॉन्ग चलती है ADHD में, 50% को बंद हो जाती है अराउंड प्यूबर्टी. दिस इज वेरी इंटरेस्टिंग. ADHD के जो बच्चे हैं, दे हैव 300% मोर चांस टू ओपन ए फैक्ट्री और ए बिजनेस. कैन यू टेल मी वाई? ऐसा क्यों होता है? ज्यादातर लोग सोचते रहते हैं ये कर डालते हैं, दैट इज द डिफरेंस.
डॉक्टर राजीव. तो फ्रेंड्स, सवाल सोचिए मत, पूछ डालिए.
I must say that was a fantabulous presentation and claps were very less for this presentation.
Yes, please.
Sir, poor handwriting is also a specific learning disability.
Yes.
Most of us doctors.
We all suffer. We all suffer.
Another thing I wanted to know, mirror writing. Just
mirror writing, yes, it is a specific sign of specific learning disability. Specifically, N is U, M is W, B is D.
Writing B the other way around and D the other way around.
These are the first things.
So, what do you do with these children?
Ma'am can answer, ma'am.
Yeah, before
make them practice rightly.
Yeah, Madam Dr. Nandini would also like to answer this. Yes, please.
No, I think the poor writing.
Because children come up to us with just mirror writing.
No, actually the poor writing, one of the reason which they, anywhere around the world they don't start writing below 6 years. In India we do it very early. So what happens, the muscles, coordination, the grasp is not very well developed. So when we start writing very early, we tend to have a poor handwriting as we grow up. In fact, this is one thing which we really have to be very sensitive, not to make children write before they are ready. Because you have to stabilize the muscles, you have to hold. That's not a learning disability at all.
But
in the writing, the writing disability comes not, I would say, about handwriting so much as they make grammatical mistakes. The semantics, syntax, how they write a sentence, how they will put a thought. I'll give you one example. I have this boy who wrote an essay on cricket. He wrote everything. He wrote the bowler, 2 sides. He was, where was the fielders, everything. But you know how he got 4 out of 10. So he came to my clinic, but his organization, he wrote about the players first, then he finished the over, then he went to arrange a field. They can't put their thoughts in sequence. So writing disability gets to be not so much on formation of letters, which I would say is not due to writing disability, but the way they present their grammar, and that is what scores them less marks.
Mirror writing?
Mirror writing, I want to tell you, is something till 6 years of age, it is acceptable as normal. It's only after 6 years if you do and B and D and think you should be concerned. Till about 6 years it's considered quite okay. Many children, and the way you teach, this is for D and this is for B, we teach them, the signs of, because they have a lot of spatial concepts.
Yes. Another question? Yes, sir.
Is there any role of meditation, especially Tratka, in the management of ADHD and learning disability?
In what?
ADHD.
ADHD in Kaplan-Sadok, they have only written 3 drugs. There are multiple drugs, but which is available in India is methylphenidate, and second is atomoxetine. Apart from that, I don't have the knowledge.
Role of Tratka, meditation.
Meditation. Sir, meditation, though we do it, he do it, she do it, everybody will benefit because that will increase the concentration. But ADHD is a chemical imbalance, and after medicine you will see a dramatic response. कई लोग तो ऐसे बोलते हैं बच्चा बदल दिया, कई बार दादा दादी नाराज हो जाते हैं कि अब तो ये शांत हो गया, बीमार तो नहीं हो गया. So they are not able to accept the amount of change the child has. And at times when the children are in 10th and 11th standard, 10 or 11 years, they are in 5th or 6th standard, बच्चे याद दिलाते हैं मम्मी डैडी को, तो मम्मी डैडी कंप्लेंट करते हैं क्लिनिक में कि डॉक्टर साहब इसको एडिक्शन तो नहीं हो गया है. बिकॉज व्हेन ही टेक्स मेडिसिन ही इज़ एबल टू परफॉर्म, और टीचर उसको स्टार देती है या उसको राइट करती है या उसको क्लास में आके बुला के क्लैपिंग करती है. एंड आई ऑल्सो फील हैव गूज बम्स व्हेन चिल्ड्रन एक्सप्लेन दोज काइंड ऑफ एक्सपीरियंसेस. सो दे डू नॉट वांट टू लूज इन ए सिंगल डे. तो ज़्यादातर मैंने ये देखा है जब बच्चे बड़े हो जाते हैं, पेरेंट्स से ज़्यादा बच्चे कॉन्शियस होते हैं. एंड रिसर्च ये कहती है कि पीपल हु आर हैविंग ADHD दे डोंट गेट एडिक्टेड. What the research says.
Yes, yes, meditation may help in addition to medication. So medicine is very, very important and essential in ADHD. Yes, Dr. Rajiv, you want to ask something?
Oh well, thank you very much. Both of you did a wonderful job. But you know, it's a real public health problem. Learning disorders. I mean, and it shouldn't be dealt in isolation by professionals like psychiatrists and pediatricians. And like you mentioned, you have a psychologist. There's an urgent need to develop these clinics, multidisciplinary clinics. And the other thing is the role of individual education plans and programs within the school services.
Yeah.
Because I see if those children who do not get a remedial education and if continue to suffer this persistent entire frustration and so much of mental and behavioral problems these children suffer. So I think if IAP can take this forward in terms of making it a public health issue and getting these children to kind of get what they need, you know.
Nowadays,
Thank you, Rajiv.
But
nowadays,
Dr. Rajiv, we have got inclusive education now. It's a policy which is coming. The inclusive education policy is that you have to provide education to all. And you have got to have now remedial teaching and school counselors as a part of, it's one of the, this thing. So no longer special schools. All over the world they have done away with. It's only in our country we have special school for these children, but they should have resource rooms but it is being implemented. Okay, in my city it is pretty good. They're trying very hard, and so I think it also makes a lot of difference if you all get together and do something here also.
Thank you, Dr. Rajiv, Dr. Pemde, Dr. Nandini.
Because, whenever a patient which is looking like learning disability comes to you, you should not always think the child is at fault. Sometimes it can be an abnormal response to some kind of abuse, inappropriate parenting practices, or parental psychopathology, or inappropriate settings in the classroom or in the school also. So we must rule out those things, then only we should start working on the child. Thank you very much.
sir, one last comment. At times parents comes and they say कि बच्चे के number नहीं आते हैं, and you ask he is getting 80%, they want 90. So at times child is perfectly normal, and in psychiatry it is written in the books. When a wife comes with a husband and says husband का ठीक नहीं है, तो 50% of the time she is having the problem, and vice versa. Similarly, when the parents come with the child, 50% of the time actually have to say कि बच्चा normal है, आप में से एक को GAD है और दवाई देनी पड़ेगी. And that is a fact.
we have lot of prizes just now, and before that I would request Dr. Dinesh Tomar from Rohtak. He is a young energetic doctor running a nursing home in Rohtak, has come to attend PCNI to honor our guests. Please, Dr. Dinesh. After this, Dr. Anju will announce poster competition result. Dr. Mittal, you would be required, sir, for the poster competition result. It's going to be a session for prizes. Whosoever will not be in the hall will not get the prize. So please be seated for 2 minutes, then we'll break for tea.
Well, good afternoon, everyone. We had 8 posters which were put up. They were judged by 2 judges. Now I'll be announcing the prizes and giving away the certificates for that. I request Dr. Subhash Arya to come on stage and give away some of the prizes. The first prize goes to Dr. Medha Mittal for her poster on malaria in children of North India, emerging new trends. Medha Mittal. The second prize goes to Dr. Garima, subdural effusion in infantile tremor syndrome. Now I'll request Dr. Mittal to come on stage and give away the other prizes. To Dr. Deena Thomas for a topic on hemophagocytic lymphocytosis associated with ALL. We have another third prize on the same topic, which goes to Dr. Neha Bansal, secondary hemophagocytic lymphocytosis in perinatally transmitted HIV. Then we have the certificates for participation. Dr. Rajiv Alawat. His poster was utilization of fixed drug combination in respiratory infections. Dr. Snelata, diagnostic challenges in vitamin B12 deficiency. Dr. Pallavi, heart block and atrial septal defect in a young child, association with cytomegalovirus. Dr. Pallavi. Thank you, sir.
Closer to the end of this conference, and our last session will start shortly, but there is some delay, 5 minutes or so in the adjoining hall, because this is a plenary session where the partition between the two halls will be opened and both the halls will be one hall, because we have a large gathering for this plenary session. And after that plenary session, we'll take out all the mega lucky draws and whatnot. I am not aware, but I am still getting confused because I am getting messages कि सर मोबाइल फ़ोन्स भी हैं, OTG भी है, वैक्यूम क्लीनर है, LCD TV है. तो अब हाँ सर इतने लेने वाले नहीं होंगे, पर एक जना एक ही ले जा पाएगा, और हमारा एज अ पॉलिसी डिसीजन ये था कि हम ऑर्गेनाइजिंग कमेटी वाले लाल फीती वाले नहीं लेंगे. ठीक है. So it is all for the delegates.
So just to start with Aristo prize distribution, can I have you please?
अभी क्यों कर रहा है?
ये वाला तो कर.
नहीं, इसको फिर नोट कर लेंगे और डिवेट करेंगे कि दूसरे हॉल में जो लोग बैठे हैं उनका हम नाम मतलब नोट कर लेंगे, एंड दिस इज नॉट वैलिड कि भाई जो यहीं बैठे हैं उन्हीं को देंगे.
We'll take out 6 slips, and if somebody is not here, please, if you know him, please inform. They can collect the prize from Aristo counter.
नहीं, यहीं से लेंगे, मेगा लकी ड्रॉ के टाइम पे देंगे. उसको आधे घंटे का माइलेज मिल गया, अगर द्वारका में ही है तो वापस आ सकता है. सर ये तो पे लकी ड्रॉ है.
तीन निकालिएगा सर.
मेरे को दे दो सर. नाम नोट कर.
Dr. J.S. Sethi. Sir, congratulations.
सर अभी वेव कर दो, बता दो कि यू आर वेरी मच हेयर एंड यू विल टेक दिस प्राइज आफ्टर द ब्रेक.
Dr. Chandan Anand.
Dr. Chandan Anand, 9015219716. दिल्ली से बाहर का नंबर है 90152.
दिल्ली का ही है.
दिल्ली का ही है. दिल्ली का है. चलो.
Dr. Virender Kumar.
सेक्टर 8 रोहिणी. हाँ सर आप
सर
मेगा हील ही वांट्स कि उसकी भी सेल बढ़ाओ, तो उसके लिए डॉक्टर DN वर्मानी जी को ऑनर किया जा रहा है. डॉक्टर वर्मानी इज अ वेल नोन पार्ट ऑफ IAP वेस्ट दिल्ली. चलो.
डॉक्टर
मोनिदीपा दत्ता निकल गए हैं. ठीक. You are the second winner for Mega Heal Lucky Draw, and
Dr. Naresh Grover from Amritsar.
ये तो आउट हैं सर. हैं
अभी तक तो थे.
शताब्दी शामवाली में तो नहीं गए. मोबाइल नंबर 98. आप क्या डिसाइड करते हो?
ये बाहर का है.
चलो we'll take a call. We have half an hour जो हमारा plenary session है, तब तक our Aristo friends will decide what is to be done for these. अगर जो claimant नहीं है, we'll take out the next.
निकाल के रख लेंगे.
तब निकाल दें.
तो फिर नाम हो जाएगा तो फिर पंगा हो जाएगा.
हाँ.
ठीक है.
ये तुम देख लो, इससे मोबाइल करके बात कर लो.
We'll break for 10 minutes. We have to rearrange this hall. Then the next session is in the same hall. We'll combine both these halls. It's a plenary session.